Good afternoon, everyone. This is Saro Arakelian, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. In this session, we will be going over a few topics and pointers about hypertension management. Make sure to subscribe to the channel to receive daily notifications on medication news, updates, and medication summary information um, uh, provided or updated or new FDA approval medications. So today I want to discuss some of the pharmacologic and non-pharmacologic treatment options for hypertension and management of the hypertension. As you know, hypertension is high blood pressure and uncontrolled blood pressure, which impacts the whole body. It's one of those diseases that you have to pay attention. Um, to find out on regular basis if your blood pressure is being managed and if it's at goal. I have another video that I have provided with goals of the hypertension and where your blood pressure goals should be. Again, please refer back to that video or make a comment on this video, and I'll be happy to go over the other video, which is hypertension goals for your body and for your age. So, a few lifestyle changes that you can make to get your blood pressure under control. The first one is, as you see over here, low sodium 1500 milligram daily diet if a patient is currently on medication. 2300 milligram daily diet if not on any medications, or decrease sodium levels by at least 1000 milligram daily, or aerobic exercise program of 150 to 250 minutes per week. This includes basically 30 minutes per day, walking, jogging, exercise, any kind of exercise that you can put in your daily routine. Per Canadian guidelines, they recommend 2000 milligram sodium daily and potassium diet of 3.5 gram or more with normal for renal function for those patients that have normal renal function. BMI goal or your BMI goal should be 25 for 25 or of 25 higher for African Americans and lower for Asians. May also use the waist circumference. For diet, the recommendation is to eat more fruits, whole fruit, vegetables, and whole grains, low-fat dairy and poultry, fish, including salmon, legumes. For non-tropical vegetable oils and nuts, less sweets, less sugar sweetened beverages, less red meats, less saturated and trans fats, limited alcohol intake of less than 2 for male and less than 1 for female, 1 ounce of hard liquor or 6 ounces of wine. Dietary recommendations also for have patients check their nutrition levels on each food. When you, as a provider or as a patient, when you go to the supermarket, recommend to your patients and as a patient, take the recommendation to check on the labels on the products that you purchase to make sure you stay within your daily limits of specific ingredients, including sodium levels, the potassium levels, and especially the saturated fat in the products because they add up. It's not just one product and it's not per serving, it's actually per the package. So make sure to check on the how much is each ingredient per serving and in the whole package. And you can easily be able to calculate how much sodium this specific package of food may give you. Pharmacological treatments include thiazide diuretics, calcium channel blockers, ACE inhibitors, ARB as first-line options, single or in combination, but not ARBs or ACE inhibitors together. If the patient has diabetes with renal insufficiency, they should be started on ACE inhibitors or ARBs first. For calcium channel blockers, could use any. However, dihydropyridines or more potent are more potent than the non-dihydropyridine calcium channel blockers. If has decreased systolic function, for the patient has less decreased systolic function, only use dihydropyridine, except nifedipine. If ages above 60 or greater, do not use beta blocker as an initial agent. Do not use atenolol, as we know recently with the new guidelines for hypertension treatment. Less it has less prevention of events compared to all other agents provided available, including bisoprolol, metoprolol, and carvedilol. We use beta blockers if any of the following the patient has dysrhythmias or a heart failure, reduced ejection fraction, coronary artery disease, concomitantly with any of these other diseases. So again, in this video, I want to go over the non-pharmacologic options, which is the sodium control for the patients, potassium control, the BMI control, and especially the diet, which helps a lot for hypertension management, eating more fruits, eating more vegetables, and exercising at least 30 minutes, 20 to 30 minutes a day, to be equivalent to 150 to 250 minutes per week. And then from pharmacological treatment options, thiazide diuretics, calcium channel blockers, ACE ARBs, and make sure not to start ACE ARBs together at the same time. And do not use atenolol if you're using a beta blocker for hypertension management. For more detailed information on hypertension management, make sure to comment on the video, and I'll be happy to get into any of your questions you may. Hope you enjoyed this video. As always, stay safe and take your medications.